Hello everyone, my name is Jocelyn and my chosen topic for today is falls interventions in hospital and a nursing home. The chosen topic is significant as it gives solution as to the older people from 60 years old and above can be protected from external injuries caused by falls. Research indicates that about 20% of all the deaths caused by falls are witnessed in the hospitals and the nursing homes. Thus from Van Dorn and others, 2003. It is possible to prevent the death and to make sure that nursing homes are a safer place for the elderly. About 500,000 to 900,000 falls are experienced every year in medical centers. Medical facilities have continued to experience falls for a long period. Research suggests that older adults experience the most fall in the hospital settings and a nursing home because of polypharmacy, weakness, certain disease affecting the patient, and ineffective fall interventions. Most of the reported cases indicate that the issue is mostly witnessed in nursing homes, rehab facilities, and hospitals. It is ironical that in a setting where the professionals bringing the question as to why the cases could be on the rise in the settings, most of these falls have affects the older people in the society, causing them more complications than they can handle. That's from Tinity and Williams, 1997. It is possible to reduce the cases if the cause is clearly established by the management of the health facilities. The main purpose of this presentation is to identify the cause falls in the hospital and nursing homes, as well as establishing mechanisms that can be employed to prevent the cases. Falls mostly occurs in the hospital and nursing care, where it is expected to be the safest place for the patients. Most of the people affected by the falls are those who cannot take care of themselves independently. Most and injuries related to falls may cost the people a great fortune without forgetting the risk factors related to falls. This is from Gillespie and others 2003. Increased pain, more medications, and high hospitalization fees, among other things, can be used to deal with a problem. Interventions relating to the problem are numerous provided that the cause is identified depending with the unique characteristics of the nursing home and hospitals. Falls can be caused by medications that are offered to patients, weakness, or the type of disease affecting the individual. If such causes are identified, different measures like that of monitoring patients with a certain disease, creating a bed range for certain patients, and monitoring the medication can be employed to help the process of reducing the incidences of falls in nursing homes. This is from Robinstein, Josephson, and Robbins in 1994. It is clear that patients suffering from stroke, cancer, gait disorders, among others, are high risk of being affected by falls. Older people of about 60 to 65 years of age are also at risk of being affected with such problem. It should be possible to create a plan that can be intervened to prevent falls. In conclusion, older adults experience the most fall in the hospital settings and nursing home because of polypharmacy, weakness, and certain disease affecting the patient and ineffective fall interventions. It is possible to reduce the cases if the cause is clearly established by the management of the health facilities. It is important to identify the cause of falls in the hospital and nursing homes, as well as establishing mechanisms that can be employed to prevent the cases. Effective interventions relating to the problem are numerous provided that the cause is identified depending with the unique characteristic of the nursing home or the hospital. Falls can be caused medications that are offered to patients, weakness, or the type of disease affecting the individual. If such cases are identified, different measures like the monitoring patients with a certain disease, creating a bed range of certain patients, and monitoring the medication can be employed to help the process reducing the incidences of falls in nursing home. This is from Robinstein, Josephson, and Robbins in 1994. It is important to take the keynote to the fact that falls contribute to most of the death in nursing homes. Many costs are incurred as a result of the problem, whereby they can also avoid it. The problem of falls can be prevented by ensuring the causes of clearly establishing the elderly people in the nursing homes should be monitored to ensure that they do not injure themselves. Prevention to the problem can also be avoided. To many deaths. The following detailed diagram indicates the channels that can be employed to deal with a fall problem in a nursing home and hospital. You can see, let me take this. The fall, if a patient fall, and within first 24 hours, we should evaluate and monitor resident, investigate circumstances, and record circumstances, resident outcome, and staff response. And between 1 to 7 days, we should fax alert to primary care provider, interventions, the immediate interventions, fall assessment, care plan development, and within 1 to 6 months, we should monitor implementation and resident response. Okay, thank you.